Toenail fungus is a condition called onychomycosis. It also occurs in the fingers but is extremely rare. The overwhelming majority of these infections occur in the feet. There are a variety of reasons for that. In the San Francisco Bay Area, over 50% of the population over the age of 40 are already suffering from this condition. Since it is a communicable disease and is a contagious disease, I can't always tell you why or why not you have or do not have the condition. I have a lot of married couples that present that have been married for 10, 15, 20 years. One of them has a raging fungal infection of their foot and the other one has never had any problems whatsoever. I can't explain this other than to say there is some issue related to the immune system. We don't really know why or why not. The treatments for onychomycosis are varied. Topical treatments will work for skin infections, but you have to continue that pretty much for the rest of your life because the infection and you just seem to have a relationship that work well together. And therefore you have to be very vigorous in applying antifungal creams to your skin on a regular basis. However, the antifungal creams are very good, but they will not penetrate the layers of the nail to get where the infection resides. And this infection usually resides between the nail and the nail bed. The next treatment is oral treatments. There are more than a half a dozen medications. The medications do have potential for liver toxicity and also kidney toxicity. This is not a common situation, but nonetheless, you are at risk if you're taking more medications, and a good number of our patients are already taking statins for lowering their cholesterol. The statins and many of the oral antifungal medications can increase your risk of liver toxicity. If you choose to have the oral treatments, baseline lab studies have to be performed, and throughout the course of the treatment, laboratory studies are performed as well. We use these studies to determine whether or not I'm going to continue giving you that medication. Most oral treatments occur for 3 months. The next treatment is the laser. Laser is extremely efficacious. It is between 80 and 88% successful. The laser penetrates the tissue and kills the fungus. When the treatment is complete, the fungus in your toenails has been completely eradicated. The treatment takes between 30 and 45 minutes. It is painless, no anesthesia is required, and it is completely safe. There are no harmful or toxic side effects to laser.